I am Anantharaman, endocrinologist with Magna Centers for Obesity, Diabetes and Endocrinology, BTM Layout, Bangalore. Today, I'll talk to you about the link between thyroid dysfunction and weight. First of all, let us understand how our weight is decided. Our weight is majority decided by our genes or genetics. So even before we are born, people who eventually turn out to be overweight or obese are larger than people who are lean and thin. So this continues even from the in utero stage to adulthood. The same BMI will track for a given individual, and majority of the weight, almost 90% of the weight, is actually determined genetically. So some people tend to gain weight when they eat much more than others. You would have noticed that actually, and this is due to genetics and environment combination. But what is the role of thyroid in it? So let me come to the very obvious answer. One is, when someone has hyperthyroidism or the thyroid gland function is increased, there is almost invariably going to be weight loss. Weight loss happens in 95% of the cases of hyperthyroidism to some extent or the other. In severe forms of hyperthyroidism, there can be extreme weight loss. Why does this happen? This happens because the thyroid hormone is responsible for the basal metabolic rate, and if there is uncontrolled production of thyroid hormone, in the case of hyperthyroidism, there can be weight loss. But is the opposite true? If the thyroid hormone production is reduced, will there be weight gain? Sadly, this does not happen actually. It is not that hypothyroidism actually causes weight gain. Many people think that hypothyroidism is the cause for their weight gain, which is not true. So whenever you develop hypothyroidism, what happens is that the body compensates by converting some of the small amounts of T4 into T3, which works at the level of the cell, and the body has a robust compensatory mechanism to make sure that hypothyroidism is compensated for. This is number one reason why weight gain does not happen due to hypothyroidism. There can be a modest weight gain of say 3 or 4 kilos weight gain due to edema or fluid accumulation and accumulation of glycosaminoglycans, which are basically protein in the connective tissue. So because of accumulation of these glycosaminoglycans, so you can have a swelling like appearance. The person with hypothyroidism can have a swelling in the face or body or a little bit of edema. This is called myxedema, and this is a small increase in weight that occurs. Typically, a large amount of weight gain does not happen whenever someone develops hypothyroidism, and majority of the weight gain is due to other factors. What are the other factors that can cause massive weight gain? Example, medication used for treating migraine can cause extreme weight gain. Steroid use for various other disorders can cause weight gain. Using antidepressants, psychoactive medications can cause weight gain. So these are the main culprits for weight gain. Apart from that, depression, anxiety can cause weight gain. There are so many other causes for weight gain other than hypothyroidism. Of course, having a poor lifestyle, not doing exercise and excessively eating are the number one culprits for weight gain. So we need to look at all other factors for weight gain whenever we have a patient with hypothyroidism who's complaining that the weight is going on increasing. Just alone giving thyroid hormone is not going to get that patient to reduce weight actually. If you just focus only on normalizing the TSH, the weight is not going to reduce to any great extent. So this is the relationship between thyroid function and weight.